Right. I think we have a very global audience today. I can see that we have 225 participants who've joined the webinar. 425, and it's rising all the time, so people are still joining. I'm also aware that we have a very prestigious group of panelists who I'm thrilled to have on the line. Thank you so much for taking the time out of your extremely busy schedules to be here to share your thoughts, your ideas, your wisdom with everybody on the line. I think as we hear conversations emanating around the world about a lifting of restriction measures, and how are we as a global community going to ensure that we resume activities in a way that's safe and does not result in increased infection around the world. So very happy to be here today, very happy to start the conversation with you all and to promote this forum of sharing of experiences. I'm just going to highlight two pieces of information from WHO's perspective before we start formally. The first is that WHO did produce some interim guidance on the 16th of April, which was entitled Considerations in Adjusting Public Health and Social Measures in the Context of COVID-19. And in this guidance, there are some specific measures related to going back to work safely. In addition, I have on the line with me Dr. Ivan Ivanov, who leads our occupational health area of work at WHO. And he is also leading the development of more specific guidances for specific workplaces. So stay tuned for that. I thought just as a start, we would, before I introduce our panelists to the group, I'm going to share with you an animation that WHO has just developed. And if you bear with me, I'm going to share my screen. And let's see if we can take it away. There we go. Right.
Preventing COVID-19 in your workplace or while teleworking. There are several things you can do to protect yourself and others from COVID-19 in your workplace, whether you are at your work site or teleworking at home. Follow distancing measures issued for your location and stay informed through information from trusted sources, such as WHO and your local health authority. Stay at home and avoid direct contact with anyone if you feel unwell or even have a mild cough. This will help protect your colleagues at work and your family members at home. If you are feeling well and need to go to work, you can reduce your risk of catching the virus by avoiding crowded public transport. If possible, go by bike or walk. Otherwise, if possible, discuss with your supervisor if you can work from home. At work or at home, if you can, use the stairs instead of elevators. Avoid using your hands to touch common objects like elevator buttons, door handles, or staircase railings. If you work in an office, create distance-based meetings either through video conferencing or by maintaining at least 1 meter space between people in the same room. If you work in contact with the public, stay at least 1 meter away from others as much as you can. After commuting to and from work and throughout the day, clean your hands frequently and thoroughly. Avoid touching your eyes, mouth, and nose. Ventilate your workplace regularly, keeping the windows open if possible. Make sure tables, door handles, and other frequently touched surfaces are disinfected regularly. Avoid crowded places and unnecessary public activities. Find no-contact ways to greet your colleagues and express affection to your friends and family. While maintaining physical distance, stay social. Contact your family and colleagues regularly to check how they are coping. Remember to seek ways to stay active and positive. stay healthy, and let's all prevent the spread of COVID-19.
Right, now on to the interesting part. I would like to introduce our panelists. We have with us today Will Ponsonby and Nick Powell. Will is the president and Nick the CEO of the Society of Occupational Medicine. We also have with us Ray Bowe, who is the head of crisis management, food safety and quality for the Musgrave Group in Ireland. We have Martin Nuchel, who is the head of crisis, emergency and business continuity management from the Lufthansa Group Airlines. We have Greta Bodino, who's the Director of Staff and Operations from the European Club Association. And we also have with us Guy Platten, who is the Secretary General of the International Chamber of Shipping. So we have with us a very broad audience, and we have tried to choose or engage with people from a range of different sectors to really highlight the different challenges or considerations that need to be taken in across these different sectors and settings when planning a safe return to work. So as a start, I'm going to hand over to Will from the Society of Occupational Medicine. Will, I have your presentation here, and so I will share that and just indicate to me when you would like to me to go to the next slide.
Thank you. So thank you very much for the opportunity to speak today. Actually, Nick's going to do the introduction and the first two slides, and then I'll take over and he'll wrap up. So Nick, do you want to lead off?
Nick, I think you're on mute, I'm afraid. Sorry.
Okay, hello, can you hear me?
We can hear you well.
Okay, hi everyone. Firstly, kind of well done to the WHO, Sarah and Ivan for your leadership, and we very much appreciate that globally. And I'm aware that this is more of a return to work conversation, but many countries still, as we are, still in lockdown, and also huge concerns about healthcare worker safety and their health, and very much support the World Day of Action that's coming up on Tuesday. And we've been doing a lot of work in the UK calling for protection of healthcare workers. So as much as this is more about preparing for recovery, I'm very conscious and concerned about the current situation, particularly for healthcare workers. And there was something in the Lancet that one of our members published about the prevalence of infection for healthcare workers in the UK. So that's the start for 10. As much as we're preparing for recovery, there are some real concerns still in terms of this awful pandemic. But in terms of coming to more hopeful preparing for recovery, build back better, I think is, I'm not saying anyone can use that obviously, but there is an opportunity to get better workplaces, good work, work that sees mental health as just as important as physical health. So this presentation is one that is a call for action for workplaces to be flexible, and where there's good leadership and management to support return to work for a better world in the future than the one we've got at the moment. But coming to the first slide, in terms of where we are in the UK, it's one where certain industries, so I don't know if you can move to the next slide. Yep. Certain industries obviously continue to function as much as we've got lockdown for non-essential workers. So, retail for food, telecommunications, transport and emergency services do continue to function, and occupational health providers obviously involved to give advice to them to protect employees and service users in accordance with government guidance. So in terms of that fantastic video, congratulations on that, Sarah and Ivan, in terms of explaining about social distancing and the protection that's needed. We support all the WHO guidance, but people are welcome to look at our website, and we produce blogs on things like working at home, technology and COVID, and different areas. And we have an ongoing updates for our members on sort of COVID resources in the UK. Next slide, please, Sarah. Okay, in terms of return to work background, I mean, this is really a government's decision, and here in the UK, the curve has flattened. It's not going down rapidly as in many countries, and it depends on new cases. And the government is concerned that if they do open up return to work, that there might be an increase in those cases, and then we'd have to move to increase social distancing once more. And it's a difficult challenge, isn't it, for governments, that they're telling the population to protect themselves and be careful, social distancing, etc. And then on return to work, they've got to say, well, actually, it's fine for you to get back on the bus and go to work, as much as protection needs to be put in place. So I think the research shows that employers are very key kind of informants, trusted people by employees, and so big role for employers to help with that message. I think the government might find it difficult to get people's trust necessarily on specific cases. Testing is a big issue. There's, in the UK, we have a lack of effective tests that have been signed off by the government. So clearly that's going to be an important test. The WHO has put that out. But one thing that's emerged here in the UK, that we're not getting the data actually from testing that does exist back to occupational health. So I'd encourage all you sort of global participants to make sure that the data sharing is happening, something we're challenging at the moment. And there obviously needs to be a big partnership between big companies like who have HR, human resource professionals, to share the data in absence and look at those people who are particularly at risk or not at risk, people who've experienced COVID or currently experiencing COVID. And also, there's really vulnerable people, from emotionally, people who've had bereavements, to people who've got sort of comorbidities. So in the current situation, I'd like to hope that WHO can eradicate COVID, but it's unlikely in the short term. So workplaces are going to be reopened where there is going to be some risk, and people are going to have to assess that risk. And there's a tightrope, isn't there, between the evidence base and practice, and going to professionals like occupational health professionals is going to be really important to advise employers and employees in terms of both protecting those most vulnerable members of the workforce and just encourage workplaces to open up under sort of best evidence-based practice. I'm going to hand over to Will now. Thanks.
So I think one of the things is we're now starting to plan for a return to work for the UK. We're not exactly sure when that will be and when the lockdown will be lifted. But one of the things is clear is that it will not be the same work environment as we had 4 weeks ago before the lockdown. Things are going to be significantly different. A lot of people have lost their jobs in the meantime. Some companies will have ceased to trade. And also a lot of people will have had experiences which may lead them to be traumatized, and some will have experienced significant amounts of stress during the lockdown for various different reasons. And so I think kind of easing people back into work is not going to be straightforward, and work is going to be very different going forward. And also the people who've had the coronavirus illness themselves, they may have some physical and mental challenges going forward. So I think we need to kind of take all of these into account as occupational physicians, and we're also going to have the problem of moving people into new jobs and pre-employment. Can I get the next slide, please? As Nick mentioned, we also have this concept in the UK of vulnerable staff. These are people who have health conditions which make them more susceptible to coronavirus. And we have the most susceptible of all are people who have to go into shielding, and they've been told to shield initially for 12 weeks in the United Kingdom, but we expect that might be extended longer until we have a long-term solution, such as a vaccine. And so those people will not be able to kind of return to the normal workplace. They may be able to work from home. And then we have other people who are classified as being vulnerable, and we're doing a lot of work looking at risk assessments for those people, so we can identify who are the most vulnerable and who need the kind of highest level of protection, and those whose conditions don't necessarily make them so susceptible and can return to a kind of more normal working life. And we're working with colleagues in other organisations and academics to try and kind of get the best evidence base on those risk assessment tables. Next slide, please. And then lastly, I think, as I say, we're not exactly sure when the lockdown in the UK is going to be lifted, but we need to start planning for that now. We need to be looking at preventive measures in the workplace. And I'm sure, like everywhere else, there's a huge debate about the role of PPE. But again, one of the things that we're very much stressing is the need for the hierarchy of controls, that elimination obviously is the best, but engineering controls, social distancing, administrative controls, and that would include fitness for work. And PPE is the lowest of those. And especially at the moment where PPE is desperately needed for healthcare workers, we need to make sure that that PPE isn't being used by workers who perhaps can have their risks controlled by other means such as social distancing. And I think as well, companies have got to be quite imaginative going forward. They've got to look at, varying the office hours to increase social distancing. So having, 2 shifts a day maybe, so an early shift and a late shift, which reduces the numbers of people in the office by 50%. A lot of, some businesses have split their kind of teams into 2, and half the team homework and half the team work in the office, and then they rotate either day and day or week in week. So that also means that if one team gets some infections, the other team is hopefully free from coronavirus. And I also think we need to look at workspace design, looking at more social distancing in the workspace, more barriers between workstations, and also all of the work, if you have shared workstations, the work around making sure they're cleaned and disinfected between users. And as Nick mentioned, there's also going to be a huge anxiety to people returning to work and very concerned about contracting the virus, and there needs to be a lot of reassurance for the workforce so that they have confidence to return to work and can feel confident that the safe systems of work are in place. And I'll hand back to Nick now just to finish off.
Thanks very much, Will. So the last slide, I hope you can hear me now, is on return to work mental health. So I'm aware that we are fortunate in the UK to be in a kind of relatively resource-rich setting. We are very concerned about kind of resource-poor settings, and I know WHO is too. And so we're speaking from a position that we know we're fortunate. But I think mental health, is definitely affects everyone the world over, whatever your resource situation. And we do know that when people have mental health kind of issues, it does obviously affect their productivity, and so there needs to be a real focus on people's mental health to ensure the return to work is as good as possible. And it's a real opportunity actually for mental health and physical health to be seen as just as important as each other. In terms of the role of the manager, we know generally that's the most critical factor, that the organisation, the leadership, the managers are confident to deal with mental health issues and support people and give them that control to get up to full speed. So managers is important, but also to think about the job design as opportunities to kind of reboot. There's a combination of home working, as Will said, in terms of shift work. There's different ways in which jobs can now be designed on the return to work. People need to think objectively about that. Next one, it's really, it's difficult for some people. People will have depleted mental health, and support ideally should be available, that evidence-based, and be that cognitive behavioral therapy, counselling. There's a tendency sometimes in mental health for non-evidence-based practice to happen, and we'd encourage an evidence-based approach, and that's obviously the value of occupational health as professionals to advise on that. think about the different ways of working. Home working may continue, but there is a risk there, isolation. So you know, the balance of that job design needs to be important. It's not all doom and gloom, though. Sometimes people can see positivity, new ways of working, an opportunity for growth. I think catastrophizing the situation may lead to people having that poor mental health, and so be balanced in that approach. Give people time to recover, and that's the best chance of a good outcome. Again, I think there's occupational health, HR that are there to support managers to have those sensitive discussions, and it's important that everyone communicates as transparency as possible about how they are. And the role of the team is really important. And to put it all together in one place in terms of mental health strategy, I think gives that assurance that people have thought through that, and that strategy might have things about self-care, signposting, etc. I think that's the end of the presentation. Welcome questions, but maybe we'll hand over back to you, Sarah, for questions at the end. Thank you.
Thanks very much, Nick and Will. I think I like what you said about, despite all the challenges, there definitely are options for being innovative in the way that we plan, particularly given all the uncertainty around us. So I think we're going to save questions for the end. So I'm going to hand over now to Ray Bao, or Bo, I'm not entirely sure. Please, Ray, I think I've got your presentation, so let me get that up on the screen, and then I can hand straight over to you. Slideshow. Over to you, Ray.
Okay, thank you, Sarah. Good afternoon, everybody. My name is Ray Bowe. I'm Head of Crisis Management, Food Safety and Quality with Musgrave, and I'd like to, first of all, thank the WHO for the opportunity to present to you all today. Before I begin, I'd like to give a brief overview of my company. If I can go to the next slide, please, Sarah. So at Musgrave, we're based in Cork here in Ireland. We're formed in 1874, and we've grown to be the largest food retailer in the country with a turnover of almost €4 billion and 40,000 employees. We continue to be privately owned, and we're now into our 7th generation of the Musgrave family. Our retail partners are located in every community across Ireland and also in the southeast region of Spain. Next slide, please. Our crisis response process for COVID was activated in mid-February, and this is due to the emerging signs of the outbreak in China at that time. 4 weeks later, our government announced significant restrictions on almost all commercial, tourist and social activities across the country, with the exception of food retailing, pharmacies and other essential activities. Our plans were in full progress prior to this, and this slide gives you a flavour of the types of communications and initiatives we had in place and we continue to have. The main theme here, or the key message, was that we're here to support our communities given the spread that we had around the country. Next slide, please. This slide describes the framework of our approach to the COVID outbreak. I won't spend too much time on this and move on to the main topic in a moment. There are 4 key pillars for us. One was the principles, the approach, the business areas affected, and finally the outcomes. With regard to the first, the principles, there are 3 key elements for us. First is ensuring the safety of our customers and our staff, which we achieve through many interventions. The second is that there's business alignment on all of the priorities that we've set out for ourselves. And then finally, having clear communication in every aspect of what we're doing. In plain English, we found it to be very important that the message is loud and clear, and especially when it's being communicated in a busy environment such as a retail outlet, and especially in recent weeks, they've been exceptionally busy in our business as well. Secondly, on the approach, this requires a multifunctional response team, which we have in place already. That was using a scenario planning approach, which continuously refined our plans depending on the evolution of events, and also having a situational awareness around what's happening through information channels, social media, and also importantly with the regulators and government as well as policy has been formed. We have the third point is the business areas. So we have three overall business areas which are described here, which are retail, distribution and wholesale centres, and our offices. And they're quite different in how they operate, quite different in terms of numbers as well. So the majority for us would be at our retail sites. And this is important in the context later of how COVID and how our staff interact in their environments, which is different in each one. Finally, the outcomes. These have included policies and very clear guidelines for those at the coalface, support processes in place for our retailers, and also having team support from management, and the final output being such things as social distancing, barriers, messaging, and reassurance for our consumers as well. Next slide, please. So when we consider the return to work scenario, we consider there to be four main categories for Musgrave employees in the context of COVID, which I've outlined on this slide. Our overriding priority here is to ensure they are well on return to work and that they remain well through the interventions taken in the workplace. So on the left-hand column, we describe all four of these. The middle column has some general comments, and on the right-hand side, what we consider important in our company. So if I take the first, where a staff member has mild COVID symptoms or has had, they will have stayed out of work until they've recovered fully and report back to work after 3 to 4 days, being symptom-free or as advised by their doctor. A return to work questionnaire is completed with their manager, and once satisfactory, they return to their role. And also we will already have had social distancing and protection measures in place in the workplace. In the second example, where there are moderate to severe symptoms, the staff member was resulting from that, there could have been possible hospitalization and a longer recovery time may be required. In this instance, return to work must take account of this and allow for possible part-time working if needed, as well as regular HR support and liaison. Again, social distancing in the workplace after return to work is important. The third category of employee we have would have been away from work due to social distancing arising from an actual or possible close contact. In this example, the questionnaire again is applied, but the employee is coming back to work, hopefully in a well condition. Our final category is those who are working from home, of which we currently have over 500 office-based staff presently, and have been so since early March. This is supported by full IT infrastructure using Microsoft Teams and other technology, and we found it to be very successful. When considering return to work for this group, there can be anxiety for some due to being back in relatively close contact again, in addition to commuting and being in public places. We have a duty as an employer to make sure the workplace is safe, and so as a consequence of working from home, we foresee that this being an ongoing arrangement for staff, even more so than we might have anticipated 3 months ago. Of course, given the different work environments as described earlier, there are some slight variations over these principles. However, they generally would apply consistently across all of the areas. So in summary, returning to work safely is not a one-size-fits-all approach, and we are finding this in Musgrave as well. In relation to the latter point of working from home, currently that is our current policy for the majority of our office-based staff as well, and we continue to see that happening into the immediate future as well. Go to the next slide, please, Sarah. On this slide, we describe the changes we have under review that will further facilitate a safe return to work for our staff. So for example, on staff protection, having temperature checks on arrival at work and during the day will provide with an early warning sign of illness onset. But like all tests, it's not without limitations, but possibly as part of other measures. The second area is face masks, which are being recommended by some national health authorities in recent weeks as a supplementary measure to control COVID transmission. We are aware of this and have it under active consideration in the coming days as well. We've also made note of training for use of face masks is as important, such that they don't become a vector for transmission in themselves. Some of the other areas we have are, which I've described here, the canteen and use of canteens where meals would be consumed at a desk or workstation and not in the workplace itself. For walkways within general offices, things like designated one-way stairways in offices, and also having internal doors remaining open. That presents other risks from a fire protection perspective, but certainly we found in advance of the closure of our offices, this measure gave a very strong signal to our existing employees that something was different and we were making changes. In workplaces, things like color coding and identification, such that if staff are moving within areas they shouldn't be, it may be more obvious. Sanitization is the increased frequency of hygienic cleaning in work areas. And again, just essentially making sure that everything is cleaner than it might have been previously. We've also identified governance as something important. COVID will eventually be a thing of the past, but until such time as it isn't, we would see having a COVID control team as part of our business to just ensure there's oversight of controls and implementation and that it stays real and live. And then finally, communications. We've been very active with all of our teams throughout the crisis to communicate exactly what's happening, what's expected of them, and if they have any questions or concerns, where to go with those, and that's been very well received. So we continue that as well when people begin to go back to work through information campaigns, posters, online communications and briefings as well. Next slide, please, Sarah. And finally, just looking ahead and beyond 2020, I think it's quite well accepted and it's been communicated by WHO that we need to live with this COVID virus for the immediate future. And we're expecting those conditions to continue into 2021 until ultimately a vaccine is globally available. And in the meantime, we'll monitor and adapt to the impact of those changes, but especially to make sure that the national controls are taken account of as well, and that our business adapts to those both internally and externally as they change. We're expecting an announcement from our government in this country on the 5th of May with regard to relieving some of the restrictions that are currently in place. So we're keenly aware that that might change how we act and control our business as well. And then just on a final note, managing the return to work and remote working will continue to be a critical issue while ensuring our business serves our customers. Ultimately, we're here to ensure our customers are provided with the service they expect from us, but we also have a duty of care to all of our staff and employees to make sure that they're working in a safe place every day. And next slide, please. And I'd like to thank you all for listening, and I'll hand you back to Sarah.
Thank you so much, Ray. You definitely shared a lot of practical, useful guidance that I'm sure will be easily absorbed by people on the call. I think what struck a note with me definitely was the value and need for clear ongoing communication throughout this time. I'd now like to hand over to Martin. Martin represents a sector that has been severely impacted by this pandemic, the travel sector. So Martin, thrilled to have you here. Please, over to you.
Sarah, thank you very much. Good afternoon from my time zone. It's here shortly after 2:30 in Switzerland. It's a pleasure and thank you for the invite. I would like to share some thoughts with you, of course. But first of all, and this really comes from my heart, thank you to WHO to support us. You are one of the most important partners also for our industry, but also for our company. And you do a great job in a very difficult environment. And it was important for me to say thank you, Sarah. Then let's continue. And honestly, I'm the one without a presentation, but I think I can guide you through my thoughts. We also are in the update phase of all this, and we have two topics to cover somehow. We have our staff, and here without being lazy and just duplicated, but I would say the presentations you saw before cover most of it that we would also use for our company. Then within the staff category, we have still two different parties. We have the ground staff and we have the flying flying stuff. One of the very few advantages, if you might call it, if you allow me to call it that way, of COVID overall is that our flying staff, the cockpit and cabin crews, they have to get used to it in a very early stage. When first Asia, primarily China, was affected, we had to already adapt measures on board to protect our staff. So if they return back to work, it will be a different workplace, but it will be something that they experienced already before. For our ground staff, as I said, measures, most of them are already described in the last few minutes. It's similar and the same, but on the other side to say, our company covers offices in Switzerland, Germany, Austria, Belgium, Italy, and Turkey. And I think I don't have to tell you that at the moment we are facing quite different measures and laws and regulations from the government. So our pure basic principle is that we take what WHO recommends. This goes into the recommendation or laws from our local health authorities in Switzerland, in Austria, and we try to compile with this, and to put it into effect. But it is a challenge. We have sometimes just the smallest equal level that we can fulfill. And at the moment, just as an example, when we talk about face masks, Austria is pretty strict about this. Germany will introduce a basic obligation to wear face masks as of next Monday in public transport and also when you do shopping. Switzerland does not do it at all. Our government just says we recommend, and if you want, you can have it, but there's no need to do it. If you feel better with a mask, go ahead. If you don't want, don't do it. So you see, only to protect all our staff in the same way is quite a challenge. But this is one part. This is our staff. This is the ground and air staff. And then we have our customers. And this is a big challenge for us as well, because here we have to see that we are just one part of an entire chain. Remember yourself, if you book a flight with any airlines of this planet, then you start your journey at home for leisure or for business. You take the taxi or your car, you go to the parking lot, or you take the train to the train station, then you drive to the airport. You have to pass check-in, baggage delay, baggage pickup, and then also security. And finally, at the gate, you board the plane. But we have to collaborate very close with all the partners before us in this chain. So we cannot say, okay, we make the planes as safe as possible, but we are outside of the plane, of the fuselage, we do not care at all. So this is quite a challenge, that the entire journey for the passenger will be safe, that we convince our customers to come back and to have a safe and good experience when they will be on board. This getting confidence is one of the biggest challenges of all. We see it also, I see it personally in my hometown, Zurich. At the beginning, Zurich people, allow me to say, were a little bit lazy about this. Said, yeah, this COVID is not such a big deal. We can handle this in Switzerland. Now we had to learn, also it hit in Switzerland. But now they overreact sometimes a little bit, and we have to find back confidence that people will come back to use plane, to use a train, to use whatever, to do their journeys. Our philosophy is also, let's take the necessary measures, but not overreact. And this is also quite challenging when so much emotions are in the game with this handling of the COVID crisis. What we would like to do with other partners, and we really reach out to other airlines within the Star Alliance where we are part of, but also with any other carrier, to set some industry standards. For us, it's important, with the help of WHO and in our sector, with the help maybe also of IATA, ICAO, to set industry standards. And one thing, and this is also kind of a private view for me, please, and this is my call to everybody, not only the aviation industry, try to put competition a little bit back in this moment. And it's not the most important thing to have the best available protecting measures as the first airline. For me, it would be very interesting and helpful that the industry can set standards, that we can work together and go ahead. What's also a challenge for us, we have a kind of a given setup, this this tube, this fuselage of a plane, we cannot just adapt it. Of course, we can block the middle seats, what we do at the moment for social distancing, but this is then an economical issue sooner or later. We have, let's say, for example, a minimum crew on board for safety reasons. We cannot just say we half-size the crew and then it's better social distancing. And we have certain procedures on board of an airplane that we will and we have to fulfill also in cases in the situation of such a crisis. For us, it's important, and this is now something where we are really working on it as a project, so how the aviation industry can come back fulfilling the concerns of the public, but also the needs and requirements from the government. For us, it's important that we, on one hand, reduce the risk of COVID-19 spreading overall. This means we try to follow the individuals when they travel to make sure that we can track them, not to supervise them, but track them and hand over necessary information to the government. That's what we already do or did also in the past. Then the step-by-step risk-based approach when we can restart our traffic, first of all, to show what we call low-risk countries. There is an initiative that maybe in June some traffic within European countries will be possible. We will see. We hope that it works. Then, of course, we support all the initiatives that health checks at airports will be implemented. If this is pure temperature screening or something else, we don't know in detail yet, but we will be here to give our hand to find solutions. This is also mostly under the execution of the authorities, of course. Full support of any contact tracing, whatever this means. It might be an app that we voluntarily use. It might be another challenge. We are here in close contact with the respective companies and also the authorities. And what's also something on our agenda on a midterm time frame, internationally recognized and that accepted COVID health certificates. This means maybe we can show immunity or recent negative testing. There are many open questions here, but of course, these are measures that we would highly support to find a way to make air traffic tourism overall possible again. What do we do on board? Specifically, we want to ensure safe and healthy travel, of course. This means increased hygiene standards along the journey. For example, we are an initiative at Zurich Airport at the moment that the handrails of the moving escalators will be automatically disinfected every time they make an entire turn. So not only several times per day to the cleaning teams, as a small step, or we discuss, of course, the obligation of carrying masks on board all the time of the trip, except maybe for lunch, of course. So these are things. We also think that we have, in connection with airports, even go one step further, obligation to wear masks from the entering departure airport until destination airport, where this is feasible. You might have heard some countries already ask at the moment, Canada, for example, Austria, that people are wearing masks when leaving an aircraft at their destination. Then, of course, we do everything on board to identify, support, and also isolate passengers with symptoms. This is something we know also from other diseases, but these concepts will be more elaborated. And one of the biggest challenges, not primarily for the airline, but in connections with the airport, will be the social distancing at airports wherever possible. Just imagine your last flight journey, flying trip to somewhere before COVID-19, how crowded was the check-in, how crowded was the bus or the metro to the plane, how crowded was the gate area. These things we also have to take into consideration to see how this will develop for the future and where we can go. This is in a nutshell what we are doing. It's really something, our primary goal is return back to a kind of normal way, well aware that the normal way for all of us will be different after that. And in our industry, we expect to be in the new normal something by end of 22 when it comes to all this. Thank you very much for your attention.
Thank you so much, Martin. I think what's striking to me is really the interconnectedness of everything, and I think what we're seeing coming out of this pandemic, if there is one positive thing, it really is this sense that we need to work together. And actually, I'm going to hand over to Guy now, because Guy Platten was on an earlier webinar we had this week that focused on the maritime sector, and this sentiment came out really loud and clear on that webinar, where we had different representatives across the maritime sector speaking, and the sound of a unified voice of working together, the ports, the ships, the crew, was a very strong voice. So Guy, from the International Chamber of Shipping, over to you.
Thank you, Sarah, and I'll be brief because I know you've got other presenters. But also have not any slides, so I'm just going to give you a little update of how we're approaching it. We've been sort of living with this since January, when it came out, because shipping has been affected right across the board. But shipping has carried on regardless, but we do have some particular issues around ship's crews, and by getting our crews to and from the vessels as well. We've got particular issues with our crews with mental health. They are often far away from their families and loved ones, and they worry about them. Plus, because we've had to extend trips because of the lack of aircraft, which we heard about earlier from Martin, to get them to and from the vessels, that's has some big issues and, as well. But we've put together industry guidance on dealing with COVID, whether on board, and the procedures to do in place. And now we're about to set out some protocols for allowing crew changes to take place. And Martin very nicely went through the whole journey getting to the airport, but we've got to really get it from our crews, from leaving their home right the way to getting to their ships. And it's an incredibly complex set of procedures which we need to follow in terms of social distancing. So it's business has carried on though, and I think we will adapt to the new normal. And I completely agree that I think it's going to be the end of middle of 2021 or to end of 2021 before we get back to anything regarding normality. So we have to work with new systems and procedures going. One of the issues that we do have now is the interaction between the ship's crew and the third parties who come on board, whether they be port officials or whether they be pilots or immigration or other type people. Because actually, if a ship has been at sea for 14 days and there's no crew displaying any symptoms, you can pretty guarantee that that crew is not suffering from COVID-19. And yet bringing somebody in from the shore onto the ship creates a danger and a risk. So we're drawing up guidelines and the use of PPE there to make that easier. But it's, you know, a lot of it already been said, have been really interesting presentations, but we will adapt as an industry. There's two sectors of our industry who have been probably affected even more. Firstly is the cruise sector, which we've heard so much about in the news, which is effectively stopped now. There's not a single cruise ship sailing now with any passengers on board. The last passengers were disembarked this week. And the ferry sector as well, which is used to large volumes of passengers and freight. And they have now got no passengers and only some freight. So they're really seriously affected economically. But the other parts of the industry are carrying on. Volumes are down on containers because people aren't consuming the same goods. So we have hold-ups in ports. But these are logistical supply chain issues which we're having to overcome so far. So it's the one thing that has come from all of this is how, and Sarah alluded to it, is how collegiate the industry has been, from ship owners to ship's crews to port officials to the regulators. And we work very closely with WHO, with our international regulator, the International Maritime Organization, and with the International Labour Organization to try and make sure we have a coordinated industry response. Because I think, as Martin said, that's what's needed. We need standards for industry going forward, rather than each company doing their own thing. And that's something we take very seriously at the International Chamber of Shipping. So I won't go on any longer, other to say that there's so many different issues which it's involved in this. But our biggest focus at the moment is how we can facilitate the changing of crews. Crews tend to do a number of months on board the ship. And once they reach the end of their trip, we need to get them home, and we need to get relief crews to join. And that has been proving for us one of the most difficult logistical challenges because there's no commercial aircraft, and two, how do you guarantee you can get the crew member safely from his home to the ship without risking infection? And that's something that's troubling us, and we're working with lots of different organisations to try and put the right protocols in place to get through that. So hopefully that gives you a quick rundown as to what's happening in the industry and our challenges which we're trying to overcome, Sarah.
Thank you so much, Guy. It's extremely complex indeed. I'd like to hand over to Greta Bodino now, a completely different sector. So Greta works as the Director of Staff and Operations for the European Club Association. Greta, thank you so much for joining us.
Thank you, Sarah. A special thank you to Martin and Guy, who made my day by having no slides and no presentations. I felt bad before starting, and thank you very much. Sarah, to you, your team, and everyone at WHO, a big, big thank you for all your work. The European Club Association is the sole independent body directly representing the interest of football clubs at European level. So I'm going to walk you through in 5 minutes what the challenges are for football that has stopped basically globally. So there is very, very little football for those who are football fans on this webinar. There is little for you at the moment, which is something from a challenge perspective now that we are thinking about how to resume training and eventually playing is something that we feel as an industry. We feel the pressure to resume training and playing, to also boost morale of people. I think football has a social element that is very, very important. Is a pleasure on one end to be working on this challenge, but on the other end is something that we definitely need to balance as well from a health and public health perspective when you think about the health of athletes and staff working in football. There are, as Sarah, you would know, many open questions still about the consequences of COVID-19 on everyone, but I would say especially on athletes. So this is one of the challenges as well that we need to try to get our head around before resuming training and playing. Another challenge, and Martin highlighted it before as well, but we represent 246 member clubs across 55 national associations across Europe. So the international element of it, when you think about finding a standard common denominator from a protocol perspective on how to resume training and playing, is definitely something that is very, very complex. Every country and therefore every club is slowly but surely trying to think about how to resume. However, when we want to have a pan-European approach, there are definitely many, many challenges that come into consideration. One of which Martin was a great ambassador before in describing it. The last challenge I would like to mention here is obviously what everyone has said before, but there is an aspect of mental health linked to isolation as well. When you think about resuming football, a lot of what we hear at the moment is this idea of isolating teams, people, staff, into a very special environment to actually be able to resume playing one day. And this loneliness, those fears are definitely something that we want to carefully look at. From a measures perspective, I'm very pleased with the work we as football industry are doing with the WHO when it comes to risk assessment. We all understand, I think, all us as panelists, and I'm positive everyone in this virtual room as well, that there will be a few months to go where risk zero does not exist. And we believe that resume playing ultimately is a question of managing those risks and finding appropriate measures to mitigate those risks. Football is what I call a world within a world. It's a special bubble to some extent. And we shouldn't just think about and base our measures and to mitigate those risks on athletes only. Obviously, they are the most visible part of our industry. However, there are many, many people that work behind what we then have the pleasure to see, whether they are ground staff, operators of buses to move people from a car park to somewhere else. There are really many people and many considerations we need to take into account. One aspect for a category that can be common across Europe are what I call office staff. And here there are a few thoughts that go in the direction of giving a possibility to these people to volunteer whether or not they want to come back or they want to continue to work from home. I think trying to give to people as much as we can the possibility to choose for those who can work from home when it is going to be also the right moment to come back is something that I encourage everyone to think about it. Last but not least, I'm conscious of time. I want to leave you with a positive thought. There is a lot of negativity as we speak, and I think we all know why, but I also think this is a unique opportunity, and I really mean it from the bottom of my heart, to reflect about a more sustainable future in all our respective industries. I want to think about not going back to business as usual, but what I call now, my sentence is business as a new usual. I think there is really a world of opportunities there, and just think about the benefits and what technology did for all of us in the past few weeks, how significantly more agile we all were, and last but not least, the commitment of the vast majority of people that work for our organizations. And these three things, I think we should just take them into ourselves and just feel strong also about building a better and possibly a more sustainable future. Thank you, Sarah. Back to you.
Thank you so much, Greta, for ending the round of presentations and talks on a really positive note. We appreciate that hugely. I am aware that we're very close to the hour. I know that we have a huge number of questions that have come into the Q&A. What I suggest that we do is, as there's been so much interest in this webinar and so many questions, that we don't try to address all the questions now on this webinar. We will take them offline, and as WHO, we will use these questions to maybe feed into another series of more tailored webinars to address the specific concerns and questions that are rising. Also, I just want to say that we have the webinar recorded, so we will be able to share the recording with you. We will be able to share also the link to the little animation that we played at the beginning. And then I haven't asked my lovely panelists this yet, but I will now. If they're happy to be engaged in the future, we will certainly call on them again, and because there has been so much rich information provided to us today, it would be a pity not to have the opportunity to capture that all again. And I'm getting a thumbs up from everybody. So I think probably just before we close, I have my colleague Rosamund Lewis, who is one of our chief scientists. I also have Andy Ramsey, who is another scientist working with us, and I have Ivan Ivanov from Occupational Health. So they're my colleagues here on the line, if they want to make a few closing comments before we end. Rosamund, yes?
Sure, thank you very much. And I really want to echo all the thanks for the incredible presentations you've made, and to acknowledge how difficult it must be for all of you, your management, your companies, your staff, your personnel at the front line. Many of us, of course, have had to continue working even harder. And you are all no exceptions to that. And others have not had the same benefit and the same luck, so to speak, of being able to continue working. So we're cognizant of all of that. I really appreciate many of the things you've said about cooperation and things like that, but also the risk assessment approach that some of you have highlighted, that really assessing risk in the local circumstance, whether it be in a different country or a different company or a different work site, and really examining not only the vulnerabilities of the individuals, but as you've described, you know, the workflow, the arrangement of spaces, the way people move through different spaces. Those are all really important, because we're not going to at WHO to be able to provide an answer for every situation, and that is not our intention, and it's not our purpose. Our purpose is to support you in any way we can in terms of this type of sharing of information, of high-level principles, of examples, case studies, and of course scientific evidence as it comes out and changes all the time. So I just wanted to emphasize that. And just as a pointer, yes, we will in fact be revising some workplace guidance that we had put out rather informally at the beginning of the EPI-WIN enterprise. And we'll now be looking at doing something a bit more formal. Ivan can speak to that on workplace guidance as places reopen. Thanks a lot.
Thanks, Rosamund. Ivan, would you like to make a closing comment? We don't see you on video.
Just to thank everybody for the great questions. I have been answering them here in the backdrop, and now I have to run to another one. I have a non-healthcare worker, sorry, but it was great, and thank you all.
Thanks, Ivan. We say the pandemic is, there's a pandemic of webinars as well, so we understand. Andy, anything from you?
Thank you. No, I think it's just to reiterate what Rosamund was saying there. I think we're in uncharted waters, and I think we're learning from each other as we go here. And I think everybody's experience is valuable here in informing what is possible, what can be done in different settings. And so I think these webinars are excellent for bringing together all this knowledge, all this experience of what works, what doesn't work. Thank you.
Thanks, Andy. So I think we're at time, and I just want to say thank you once again hugely to our panelists. Thank you to all the participants who joined, and I look forward to working together with you going forward, and as we see this evolution to a new normal. Thank you, everybody, for taking the time.